when I get older, I would like to be treated with respect and dignity.
Just be treated like how I'm treated now, really. I don't think the aging process doesn't change who you are.
I think it would be very hard if a person hadn't had a full life. You know, they'd be trying to play catch up.
It does take courage to live into your elder years. You've lost some of the physical abilities you had. You may have lost some of the mental sharpness, and people judge.
I think families are trying their best to keep their loved ones at home. But if you have kids and a life and a full-time job and your mom has dementia and she's leaving the oven on, it gets kind of tricky.
Long-term care needs a redefinition. We are now waking up to the fact that our elders have been neglected for a very long time. Sooner or later, it's going to be us who may need to live in these sorts of situations.
The last 30 years have just disappeared. I'm 84 now. I've lived here 5 years. The first year I was in a different wing. It was a 4-bed unit, and that was very difficult, very difficult.
We call it the medical model, the institutional model. The model of care based on large buildings that house many residents in settings that really are not anything at all reminiscent of a home. We like to call them homes, but if you walked into them, you would actually think you were in a hospital. To imagine that it's anything less to elders who are being cared for in those situations is just not realistic.
Institutional model of care is built for the efficient care of the masses. So sometimes that personhood is kind of downgraded a few notches, and their medical condition or their surgical procedure seems to be the paramount thing.
Sadly, their physical needs seem to take precedence over their emotional needs, their spiritual needs, their needs for things that are beyond basic care.
Sometimes when you get caught up in like, oh my God, I gotta get like 12 people up and so-and-so's got, so-and-so's family's coming, so we gotta get them all done, and it's just this constant juggling of time.
We know we're on a bit of a schedule, but we're also relaxed. I'm aware that the girls always have 6 to 10 other issues on their mind. They don't talk to me about it, but I know.
They all want to do their best too, right? Because there's like, well, I would never treat my parents this way. So they all have their own kind of expectation. So when they can't meet those expectations, they're pretty hard on themselves.
And now they're wearing those masks, it makes it harder.
In healthcare, we run often at very fine margins. Our systems are dependent on there not being too many crises, but COVID has taught us that the crises can be long.
None of us at the time had any idea that there was anything to protect us, and certainly nothing to protect our elders, who really died at very dramatic rates, which was a very sad situation. It really put the spotlight on how these elders were living in their facilities, sharing a room with anywhere from 1 other to 3 other residents, separated only by a curtain, and the rapid spread of infection was borne out in those types of situations. So it really is not a way for elders to live.
A pandemic takes away the living part of life. We're forced to isolate people in their rooms. We've been forced to isolate people from their families. That's the challenge for us going forward. Maintaining that safety, that level of rigor that keeps people safe from a thing like COVID, but we have to find ways to maintain the living, the quality of living that is so important to human beings.
We need to move away from medicalizing the end of people's lives, and the shift is towards the social needs.
And the social care has to shift that to being less time efficient and more focused on that individual controlling their own day.
We've got great research from around the world. We know the kind of buildings that work.
There are a few models that are in existence across the globe. One of them in the Netherlands, it's called De Hogewijk. It is a typical village concept, a situation where elders live in small homes with small numbers of fellow residents and live a life that's much more natural. It's truly creating a small home for a small family of residents.
All the homes have 12 beds, 12 rooms with private bathrooms. There'll be a common area and a kitchen that they have access to. We're going to be changing how many people walk through those areas to try to normalize their lives. Like, you don't have housekeepers and you don't have laundry staff walking through your house at home, so they shouldn't be having that here.
So making our facilities and our services appear less clinical, less medical, but still maintaining that medical clinical rigor that people with that level of complexity require.
There'll be a coffee shop there where people from the external community can come into our internal community. And there'll be play structures to try to welcome families when they come in to bring their children. There's going to be a daycare there, incorporating youth with the residents.
It's going to create a natural hub of activity that will be in itself stimulating and interesting, not just for the elders themselves who will be exposed again to the world outside, but in fact it will also help to expose the children of tomorrow to the elder part of our population.
We're talking about changing a culture of care that's focused on what the resident wants in the moment versus the list of tasks that the worker has to get through.
The infrastructure that we have is not only old, it's wrong. It needs to be corrected. This is going to require redevelopment of virtually every site in the province, if not the country, for the social needs of elders.
It takes courage to get old. It definitely is not an easy process.
I think the biggest thing that it will give from most people is that they won't have to fear living in a care facility the way some people currently do. I think they will see the care facility as an extension of their own home, hopefully. They'll see it as a place that honors their values, their traditions, the interests that they have. And I think they'll see that we can convert our compassion and our hard work into also a day well lived for the individuals.
There's a divine hand that's leading you, whether you believe it or not, and you go with the flow and you learn what there is to learn.
You can't physically touch the success that we're going to have. As supportive as the government is with all of the demands they have, they just can't give us all the funds that we need to do all that work. So I'm extremely grateful to the St. Paul's Foundation for the funds that they already provide us, and hopefully for the funds we'll get in the future. And I'd say to those donors that funding elder care may not be as sexy as a CAT scanner or some other large medical device, but what you will see over the years to come is the life experience of those elders we're looking after, which could very well be your loved ones or you yourself, be something you can be proud of and something that we can be proud of.